Imagine the sticker shock. You've been told you need $50,000 worth of dental implant work. Is this really necessary? Do I have cheaper alternatives? In this video, I'm going to reveal your top 10 options to pay for and get your dental implant work done. Welcome to Smarter Dental. Absolutely shocking, right? Picture this. You just left your dental office and they just hit you with a $50,000 dental bill for full mouth dental implants to replace all your missing teeth. Now, this can leave anyone feeling reeling, right? This is a common procedure. Perhaps your teeth are already loose, or you've lost a lot of teeth, there's only a few left, or some of your teeth are broken off of the gum line. Many people are also dealing with severe periodontal disease and they just need a fresh start. So your dentist will recommend procedures such as full mouth all-on-4 dental implants, or upper or lower fixed hybrid bridge, or implant supported dentures, right? The bad news is that the average price for full arch dental implant procedures are $25,000 per arch, or $50,000 for full upper and lower. If you live in cities that have high cost of living, the price goes up. We've had clients at Deo Dental get quoted anywhere between $70,000 to even $90,000 worth of dental work, right? Now, not many of us have $5,000 just waiting in the bank for unexpected work, right? Let alone 10 times that amount. So the $50,000 bill can feel like an insurmountable financial challenge. The good news is that you have alternatives. In this video, I'm going to reveal your top 10 best options to pay for your dental implants and get the dental work done. I'm also going to reveal some options that will allow you to save up to 50 to 70%. So stay until the end of this video to get all those options available for you. Lastly, I'm going to rank these options on a scale of 1 to 5 purely based on their viability and popularity. So let's begin. Number 1, dental financing. Your dentist is probably going to present 2 or 3 financing options to pay for your dental implants. The most popular ones are Proceed Finance, Lending Point's a good one, and Care Credit. But here's the thing, right? You typically have to have a credit score of around 650 or higher to qualify for these financing. And even if you do, the interest rates are high. Imagine buying a $50,000 Tesla car and paying it off in 5 years. But the interest rate is not 4 to 6%. Depending on your credit score, the interest rate can be many times that rate. So on a rough estimate, you're looking at around a monthly payment of $800 to $1,300 a month on a 5-year $50,000 loan. And get this, the interest rate is around 7 to 30%. Yes, medical financing interest rates can be quite punishing. So I'm going to give this a 3 out of 5 on our viability scale. Number 2, go to a dental school. Now, you may have a dental school close to your area, but most dental schools are concentrated in big cities, so this option may not be available for everyone. Many of these students are supervised by very good instructors, but still, it's a student working on your complex case. You're going to be able to save about 30 to 40% by going to dental school, maybe even more. But keep in mind, it will take you longer to get your full mouth implant done at a dental school. There might be a waiting list to get in for these types of procedures, which can add weeks or even months to your wait. You also have to work around the student's schedule, right, which can add another few months to your work. They take breaks, they have a curriculum to follow. You may have to work with various students as they graduate. So an implant specialist can finish your full mouth implant work in about 4 to 8 months. The dental school, this can take up to 2 years or more. So for this, I give it a 3 out of 5 just because of the long waiting period. Number 3, loan from family and friends. Maybe you have a rich uncle. Maybe your parents are generous and they're willing to help you have a fresh start by getting a brand new set of teeth. However, not many of us have family and friends that can provide a loan such a big amount. Now keep in mind, these types of loans and assistance have pitfalls, right? You have to be clear on the term of the loan or the assistance, including payment expectations and interest rate, right? Failure to meet such terms can lead to conflicts and misunderstanding. So for this, I give this a 2 out of 5 just because not many of us have a rich uncle to rely on. Number 4, find a cheaper dentist. I'm a big proponent of shopping around in your area to find better prices on your dental work. Maybe look around outside your neighborhood or city. But finding a cheaper dentist carries its own risk. The average price for an all-in-4 is $50,000 for full mouth, upper and lower. You may be able to cut the cost by $5,000 to $10,000, but finding someone at a much cheaper price on that may mean that they're using lower quality dental implants or maybe an inexperienced dentist for that situation. Nowadays, the margins are thin with US dentists, with the advent of inflation and labor shortage. So they really can't discount their work too much. It's not like in the 80s where if you're a dentist, you're basically a millionaire, right? So I've seen cases where it's just one of those things, you get what you pay for, right? I've seen cases where patients have been able to save substantially by going to a cheaper dentist, right? But that optimism quickly faded because the implants failed after 1 to 2 months, right? To make matters worse, their dentist is not willing to rectify the situation. And some of them, they're not even calling them back, right? And even worse, they can't find another dentist that would be willing to fix those failed implants because they don't want to take that responsibility or that liability of fixing a malpractice situation. So anyway, just know it's one of those, you get what you pay for, right? Look for a dentist, ask what their experience level is, right? Ask them, what happens if something goes wrong? How will you help me out if the implant failed, right? Don't pay for the dental work up front, the entire dental work up front. Just pay for the procedure that you're getting at that moment in time. So typically with implants, you pay for the first stage, which is the implants installation. And after a few months, you pay for the other half, which is the prosthesis installation. Anyway, in the future, I'll be doing more videos about how to choose an implant specialist for your case. So please like and subscribe this channel so that you would get updates that will help you make an informed decision about this. So finding a cheaper dentist, I'll give this a 3 out of 5 on our viability scale, as long as there's a caveat. You're not looking for the cheapest price or the bargain hunting for a dentist that could get you in trouble. Number 5, dental grants. You may have seen advertisements about the dental grant. So while there are true government provided grants or privately provided grants, those funds are very limited. Some dental grants are basically just lead generation providers for dental offices. So here's a typical situation. You go online, you encounter a grant, you apply for it, and then they set you up with a participating provider. You go in there, get a consultation, you get a treatment plan with a code and a partial grant. Typically, that part of that discount is absorbed by the dental office. So does it save you money? Let's say the average price of an all-in-4 in your area is $50,000. And your dentist quoted you $60,000 for full mouth implants, the all-in-4, but you receive a $15,000 grant. So your cost ends up being $45,000, right? You get a 5,000 savings there. Is that enough, right? With grants, it's important to know the average cost of the dental procedures in your area to really get true value in it, to really assess the true value of the grant, right? In my 15 years working in the dental field, I have yet to encounter a person that has substantially benefited from a dental grant. So for this, I give it a 1 out of 5. Number 6, your community dental clinic. Community dental clinics are there as nonprofit dental clinics to help underserved or economically disadvantaged people in your area. you may have to qualify or show proof of income. You may have a hard time getting a community dental clinic to do this procedure for you because community dental clinics don't really specialize in these kinds of complex implant procedures. They specialize mostly in more common procedures such as cleanings, fillings, and extraction. They may take 1 or 2 cases of these full mouth implant procedures a year because of limited funding. So I give this a 1 out of 5 again because they really don't have the funds to do these kinds of complex procedures. Number 7, loan from your retirement or home equity funds. I know this could be a tough pill to swallow because you're probably hoping to save those funds for future use, but a loan from these kinds of assets are a lot better, have a lot better terms in terms of interest rates than dental financing. Now, if you are one of those people who have these kinds of assets, it's a good option. Yes, you're foregoing the future use of those assets, but this is your present health at stake. It's about your quality of life, right? You may be in a position where if you don't do anything, your situation may get worse. So I give this a 3 out of 5 if you have these kinds of assets to rely on. Number 8, dental insurance. You might be thinking, wait, let me get dental insurance to cover these kinds of procedures. Now, I hate to be a downer because none of these options I'm providing you is really a true slam dunk, but dental insurance is not going to cover your $50,000 dental implant treatment. Some don't even cover dental implants at all. And even if they do, there are all kinds of clauses with dental insurance, such as a 6 to 12 month waiting period before you can get more complex procedures, or some have a missing tooth clause where if the tooth was already missing before you got insurance, they won't pay for any replacement of that tooth. You may be able to get your insurance to cover some of your preparatory procedures, such as your evaluation for the dental implants, the extraction, but you can only go as far as getting a removable denture. They won't pay for procedures such as fixed permanent teeth supported by dental implants. Furthermore, the biggest thing is that dental insurance have a yearly cap. The most common is about $1,500 to $2,000 a year. That's the most you can spend. So could help a little, right? For this, I give dental insurance a 1 out of 5 because you can't get insurance to cover these big complex dental implant procedures. Number 9, go to Mexico. The number one procedure people go to Mexico for are dental implants, from single tooth implants, bridge supported with implants, all-on-4, these full mouth dental implant procedures. For the same $50,000 procedure, you might pay around $20,000 to $25,000 in Mexico. Those are substantial savings. In my previous video, I've mentioned some of the top places in Mexico where you can find some of the best dentists to do these implant procedures. At Deo Dental, some of our top dentists even train US dentists who travel to Mexico to get live surgical implant training. This going to Mexico is available for everyone, and millions of people do this. You know what's the best part is that you can see a top dentist in Mexico and still get substantial savings. If you want to see a top dentist in the United States, you may have to pay more than $50,000 for this procedure. So I'm going to give this a 4 out of 5. I'm not going to give it a 5 because there is that inconvenience, of course, that you do have to travel to Mexico to get this dental work done. Number 10, do nothing. Yes, implants are expensive, and for some of you, none of these options are available to you. But for some of you who have at least 1 or 2 of these options available to you, doing nothing carries a big risk. Infected teeth can get worse. There's been studies where infected teeth, gum disease, affects your heart and can contribute to dementia. It's hard to function when you have a toothache. Plus, the longer you wait, the more chances you'll lose more jawbone. Jawbone is crucial for successful dental implant surgery. Without enough jawbone, you can't place dental implants, or it'll be more expensive for you because they have to rebuild the jawbone and do more complex bone grafting. Yeah, I've even seen situations where patients want implants, they have the money to pay for dental implants, but they can't qualify for dental implants because they really simply don't have enough jawbone. Now, I'm not going to rate this option for you because every situation is unique. Your financial situation is unique. Your dental case and the challenges that you're dealing with is unique. So anyway, there you have it. I know I didn't present a slam dunk option for you, a 5 out of 5, but really, there really isn't, one. But hope you find this video helpful. Please like and subscribe this video and check out all of our other videos that will help you navigate the world of implant dentistry and how to get your dental implant done. Thank you.